When it comes to breast cancer screening, there's actually slight differences depending on which governmental body you're talking to. And so, my name is Dr. Cheng Ron here at Texas Center for Lifestyle Medicine. I want to talk to you about breast cancer screening. And so, when should breast cancer screening really start? There's guidelines that are put forth by a lot of different societies. There's United States Preventive Task Force, American Cancer Society, American College of OBGYN, American College of Radiology, American College of Chest Physicians, and they all slightly differ a little bit, but I'm going to give you the gist of it. And so, women ages 40 to 49 with an average risk, which means no family history of hereditary cancers or no previous history of breast cancers. So, these are the women in the average risk. For those women from ages 40 to 49 should really have a conversation with their doctor about whether or not to screen in the first place. There's reasons to screen that are personal, that a lot of women want to focus on breast health, and they can certainly start at the age of 40 should they choose to. Who should they really ask? Well, they should ask their primary care doctor, a breast surgeon, and an obstetrician gynecologist to order these exams. And so, what happens is that the frequency of screening differs a little bit. So, and according to the American Cancer Society, women ages 40 to 49 should have an option to screen once a year. Um, and then, but in the American College of OBGYN, it's really a personal decision. And they say, talk to the OBGYN, and the decision can be made whether to screen once a year or once every 2 years for those women between ages of 40 to 49. It's a little confusing, but it really depends on who you ask. Now, let's talk about women ages 50 to 74. So, the American College of OBGYN, or ACOG, states that screening with mammography is really recommended once a year or once every 2 years. Once again, that decision it's very personal, and it should be shared between a patient and their OBGYN. But that also may include clinical breast exams. And so, American Cancer Society did not include the clause about the clinical breast exams, and actually stated that in the average risk women, clinical breast exams are actually not recommended. And so, why are there two different opinions? Because the American College of OBGYN deals with obstetricians and gynecologists who deal with women's health and tend to have more experience with clinical breast exams, versus American Cancer Society, and then another society called the USPSTF, the United States Preventive Task Force, and also says that, hey, there's not enough evidence showing that these clinical breast exams could be very beneficial for early breast cancer detection. So, the story here is that if you go to your gynecologist, you may be able to get clinical breast exams, which may be helping in assistance in diagnosing breast cancer earlier on. You go to a primary care who's not following the recommendations by ACOG, which is the American College of OBGYNs, I may not be getting that service. So it really depends on, and it's really, really up to you. But let's talk about another difference in the American Cancer Society versus American College of OBGYN. The American Cancer Society states that women ages 50 to 54 should also be screened once annually, and then 55 and older can be every 2 years or so, which is a little different than ACOG, American College of OBGYN, which states that 50 to 74 you can screen possibly every 2 years. So the decision to stop screening for mammograms at age 75 is actually supported by the American College of OGIN, but the American Cancer Society, there's not really a stop date. They just said that as long as the woman is healthy and expected to live 10 years or more, screening should really continue as well. Once again, that's part of it is a personal decision. Here's a bit of a caveat. So there's also women with dense breasts, and we see that a lot. And so these people should the woman with dense breasts should really work with their practitioners on what is really the best approach. And usually we start with a mammogram and then transition on to ultrasound, and sometimes In some situations, a breast MRI if necessary, but once again, it's very specialized. Something definitely to talk to your doctor about. So far we just talked about the women at average risk in the average population. So what about the women in high risks? Well, these guidelines also differ a little bit because the risk has to do with genetic predisposition. So some women have a genetic predisposition for breast cancer, like BRCA1, BRCA2, and other genomes as well. And some people have a family history of different types of cancers that predispose them to having breast cancer. So this high risk population also a very individualized approach and something to talk to your doctors about as well if you're one of these women in the high risk category. So this is the summary of breast cancer screening guidelines. Thank you very much.